Imagine you are holding a rubber band. You pull it back, and then you let it go. That snap is exactly what happens to your jaw during a car accident, even if you never hit your head. Let's say that you were rear-ended and your neck goes through that stereotypical whiplash motion. But now it's a couple days later and you're starting to notice that your jaw hurts. Maybe you notice that it's clicking when you chew, or when you wake up, your face is sore. Now, you never got hit in the jaw, so you assume that it's just stress. But it's not just stress, it's actually a secondary impact of a whiplash injury. Today, I'm going to take you through the physics of whiplash and why it's one of the leading causes of TMJ injuries. After that, we'll be going over an easy 30-second test to check and see if your whiplash injury caused an issue with your jaw. We're going to start with a short story about Sarah, because Sarah was rear-ended about 20 miles an hour. So, the normal thought process is we were rear-ended, we'll have whiplash symptoms. Sarah actually went one step further whenever she started to develop jaw pain, because she figured since her head whipped back and then her jaw shut closed, maybe she had chipped a tooth, and that's what caused her jaw to start hurting. And she did what I would expect anybody with mouth pain to do. She went to her dentist, which makes complete sense. And there he took an x-ray to make sure that she didn't have a chipped tooth or anything going on below the gum line. But here's the problem. TMJ is just like any other soft tissue injury. Even when we x-ray it, it's not going to show up. Since Sarah's dentist couldn't find anything on x-ray, she just went back to sleeping with a mouth guard. But she kept noticing that day after day her jaw was getting tighter. Like I said, Sarah was smart enough to realize that that forward and back motion from a whiplash injury could have affected her mouth from the impact of her teeth, but what she didn't consider was that that quick acceleration injury could displace the disc in her jaw. And what this anterior disc displacement does is it forces the joint capsule that separates your jaw from the rest of your skull to launch forward, and it gets stuck there. And you can imagine how uncomfortable it is to have a piece of popcorn stuck between your teeth. So now imagine having an entire disc, which is about the size of 2 quarters, wedged forward over top of your jaw. By the time I met Sarah, she was having a pretty hard time just opening her mouth, which makes that initial assessment a lot of fun for both of us, because it hurts to talk. But the good news is that once we were able to mobilize the top of her cervical spine, because those muscles are very closely related and integrated with the muscles in your jaw, and then we did a little bit of release work with her lateral pterygoid muscles, her pain started going away very quickly. And that's why I want to talk about this today, because a lot of the time patients are going to see a dentist for mouth pain, which makes complete and total logical sense. But if that pain isn't getting better, then you need to see this. Here's the physics. When your car is hit from behind, your body is pushed forward, but your head stays where it was. This causes your neck to go into extension. Because your jaw is heavy and held on by muscles and ligaments, it also stays where it was as your head begins to move backwards. This throws your mouth open with incredible force. Then, as your head snaps forward into flexion and catches up to the rest of your body, your jaw slams shut. This rapid open-shut cycle happens in less than 300 milliseconds. Now, if you take your fingers and you move just a little bit in front of your ears, you can feel that jaw joint whenever you open and close your mouth. And on that jaw joint is a tiny disc of cartilage, and whenever you have that quick open and shut of your mouth, what can happen is the cartilage that holds that disc in place can rip, and then the disc itself slips forward off of that joint capsule. And what you might notice whenever you're chewing your food or every time you open and close your mouth really wide is you hear this clicking right in front of your ear, and that's that disc slipping off and onto the joint where it's supposed to be. A couple crappy things can happen here. One is that the disc slides forward and it stays there because the muscles in your jaw that help it open and close kind of lock out or swell so much that they keep the disc out of place. The second thing that can happen is that disc will move forward and it'll actually cause your jaw to jut off to the side and lock a little bit. So if you start noticing when you open and close your mouth, it looks like this. Not a good sign. And the third thing, and kind of an illogical one until you really think about it, is that your neck muscles can get so tight that they actually start pulling your jaw off in one direction, and that can also cause the disc to get stuck. And when that disc gets stuck, especially if it can't slip back onto the mandibular joint, is you'll get lockjaw. If you've ever had lockjaw or you've ever even snapped out of lockjaw, it is terrifying because that joint, like I said, is right here. I had this happen to myself once, and whenever it finally snapped back into place, it sounded like a gunshot. Hurt a little bit, but the main thing was just how loud that joint was that close to my ear whenever the disc finally snapped back to where it was supposed to be. It was a cool party trick, but I definitely don't recommend doing it. So, how do we know if the TMJ that we're experiencing is coming from a whiplash injury? Super easy trick. You don't even need any tools or equipment. You're just going to want to wash your hands. What you're going to do is put your 3 fingers together, Scout's honor, and comfortably open your mouth and see if you can fit these 3 fingers into your mouth without it causing pain. Another thing that I'm going to say, just so no one does it, don't shove these all the way back trying to touch your uvula. It's just right on the edge of your teeth. If you can comfortably fit those 3 fingers into your mouth, then you probably have at least 40 millimeters of opening between your top and bottom teeth, which is normal. If you're unable to fit all 3 fingers in, or even 2 fingers in, it's more likely that you do have swelling in that joint capsule or displacement of that disc, which is going to then cause issues with opening and closing your jaw. Additionally, I know that some of you like to try and outsmart me on this. If you can get all 3 fingers into your mouth, but it hurts or it stabs, this is a positive sign that you probably have some sort of TMJ dysfunction. Also, something that you can do that doesn't involve putting your fingers in your mouth is standing in front of your mirror and opening and closing your mouth, seeing if that jaw juts one way or the other as you do this. And it's always easiest just to look at your chin as you open and close, because if you open and it goes off to one side, sort of like that, then what that means is that the ligaments on one side of your jaw and the muscles that are moving those joints are stronger or tighter on one side versus the other. So instead of that jaw joint just opening and closing, it's pulling one way or the other because of that imbalance. Now, if you're like Sarah and you either had a whiplash injury or just some sort of blunt force trauma, and now you're experiencing jaw or mouth pain, please go to your dentist. Please have them double check to make sure nothing is chipped or broken, because that's something that we really don't want to be pushing around or trying to get the muscles to relax. Those muscles would be in spasm to protect that broken joint. But if you go and you get imaging and it doesn't show any signs of fracture, your next step is going to be looking at the muscles and the ligaments that stabilize the joint, but also stabilize your neck. Because as crazy as it seems, everything in your body is connected. And it's no surprise that if everything's connected, then something right here on your face is probably closely linked to something right behind your ear. If you failed that 3-finger test, what I want you to do is download the free TMJ release guide. What it does is it shows you different pin and stretch exercises that you can do for your jaw so that those muscles release some of that tension and you can get better movement of that joint. And what you might even notice is that as you start relaxing those muscles, the joint just goes right back into place and you don't need to do anything else crazy. And if after trying those exercises in that recovery guide, you still experience symptoms, check out the Whiplash Recovery Blueprint. We go through everything in there that I would go through at the office, from relaxing the muscles in your suboccipitals to cervical bracing to help reinforce the contraction of muscles that support your jaw. Most importantly, stop ignoring the secondary impact of a whiplash injury. Realize that your neck and your jaw are connected, and you need to work on both of them together if you want to get lasting relief. Thank you guys so much for watching. I'm Dr. Beck, and I will see you in the next video.